Welcome. I am Sandra Scheinbaum. I'm the founder and CEO of the Functional Medicine Coaching Academy. And we are here today to talk about getting paid. How do you get paid as a coach? And today we're talking about how you can work with a doctor in a doctor's practice and how that doctor can use an insurance model. So I am just so thrilled that I have with me today Dr. Cheng Ruan. Dr. Ruan is the founder of the Texas Center for Lifestyle Medicine in Houston, Texas. This is a multidisciplinary, integrative, and functional medicine medical clinic, and it utilizes insurance and even Medicare in hopes to bring integrative health into mainstream medicine. Dr. Ruan is board certified in internal medicine. He completed his internal medicine residency and chief residency at New York's Presbyterian Queens. So welcome.
Thanks so much. Thanks so much for having me.
Thank you. And Dr. Ruan works with functional medicine certified coaches who are graduates of our school. So I'd love to talk with you about your clinic and how you use coaches, and then we can move on to talking about how you are getting insurance companies to pay for what they're doing.
Absolutely. So I'll tell you the story. So the story is in July of 2017. We opened our doors to Texas Center for Lifestyle Medicine. And during that time, I didn't really have a very clear model of how I wanted to incorporate health coaching. So we didn't really have health coaching in the very beginning. We had a dietitian. And you know, for me, I'm very passionate about just functional medicine, trained through Institute of Functional Medicine, and wanted to utilize the meal plans, you know, Motto food plan and cardiometabolic and core and detox food plans, because it's nice and standardized, and also gives me references to bibliographies. Now, it's really hard to find someone who understands all of that unless they've been through, you know, Functional Coaching Academy, right? Health coaches are awesome, first of all, because it allows practitioners, physicians, and nurse practitioners, and physician assistants, and the medical staff to have some breathing room, right? And the biggest gap in medical care right now is the lack of coaching. That's by far the biggest gap, right? And that's where you have medication errors. That's where you have people feeling a very big mistrust and distrust towards the healthcare system because of lack of communication or miscommunication. And it also allows a practice who may be very volume heavy to have a lot of people fall through the gaps. And every practice have patients fall through the gaps, every single one. It's a natural occurrence of practice. But how do you stop the hemorrhage, right? and you stop the hemorrhage by incorporating health coaching, okay? And so, you know, I'll give you an example. I was talking to someone who we're interviewing who's actually going to be starting with us next month. And he is a plant-based practitioner, plant-based certified practitioner. He worked for a vegan cardiologist prior to this, and worked for endocrinology after that. And then so his deal is that when he worked for the endocrinologist, they were giving him 15-minute time slots. He's like, I can't talk to my patients about diet, right? And what it does, it just accelerates this burnout process. It's like, I know what's good for you, but I can't talk to you about it because I have 15 minutes with you. And 7 of the 15 minutes is taken up doing vitals and all this stuff by the medical assistant, right? So I really have 7 minutes with you. But actually, it's really like 5 minutes because I need 2 minutes to document, right? That's a very common occurrence. You know, I used to be in the model as well myself. And so there's two ways to fix that. One is for the practitioner to do group visits, so you can spend an hour with 10 patients and talk about these things like that, right? And two is actually schedule them with a health coach, either on the same day or another day, okay? Well, technically there's 3 ways to go about it. And 3 is to do both, to do group visits where the physician talks about the importance of what we're going to talk about today, and a health coach to take over on that group visits, right? So the physicians can take that time to go into their individual visits, right? So schedule that 15-minute in the beginning where I talk about how important this is and thank you to everyone for coming. And then the rest of the 45 minutes, the health coach can take over with different type of sessions. Ours do mind-body medicine, they do functional nutritional counseling, and so on and so forth, right? And so the health coach is so integral to prevent someone like me from burning out, because we see a lot of patients. We have 7 practitioners going on 8 in the practice, right? And probably 9 in another couple months. By June we have 9. And so we're expanding because the demand for our services are so great because we take insurance, and so what I see is that if there's a disconnect between the health coach and the practitioner gets stressed, the health coach gets stressed. Once there's a beautiful communication relationship, everyone's happy. The patient's happy, the practitioner's happy, the health coach is happy, the medical assistants are happy because they don't have to take complaints over the phone call, right? My office manager is happy and everyone feels like we're doing something good for the patient. And it turns patients who a lot of physicians think are difficult patients, right? Or patients have a lot of diagnoses that are complex, into the best and motivated patients in their practice once they make that switch and transformation. It's incredible. I've seen this in multiple practices. So, I consult with MPE Consulting, which is a practice consultation company of working with practices working in insurance. And so I'm able to see smiles on physician faces. I've seen physicians crying next to me because they can't make ends meet. They're like, how am I going to afford a health coach? Into, why didn't I do this 20 years ago? Right? And so it takes processes and it takes time. It really allows a blossoming, a reignition of passion into a practitioner's heart. Because we as practitioners, we came into this to help people, but we got stuck doing paperwork and Medicare and electronic medical records and stuff like that. And it becomes, it's not what we signed up for, right? And the complexity of billing in the Medicare and healthcare system is significantly more than it was before. And the reimbursement is significantly less, so it requires a high level of knowledge. The problem right now is that because there's a disconnect in this high level of knowledge, that's where health coaches are heavily underutilized. There shouldn't be a reason that health coaches have a hard time finding jobs. It just requires these practices to understand that this is a really turnkey system that we can do, and here it is. This is how we do it. This is how we bill for it. And whether they have a cash practice, cash is easier because you can charge a fee, right? Or is the insurance practice, insurance we do preventative codes, CPT codes, and everything like that. It doesn't matter, but it allows the practitioner to have that sense of passion again, And I remember when I went to my very first Institute of Functional Medicine conference. It was a cardiometabolic conference in Austin, Texas. That was February of 2017. And everyone around me were practitioners who had the knowledge of integrative health. 90% were not applying it in the practice. They can't. They have 10-minute slots, 15-minute slots. There's no time. And, doctors are not necessarily the best business people either, so it's really hard to incorporate that structure of health coaching. Also, these functional medicine conferences, really the office managers should really attend them and think from a managerial standpoint, all right, how to incorporate some of these in to help the patients, right? Because the physicians and the practitioners may not be working with workflow directly. They may not be working with this and that, right? So what happens is a practitioner tries to adopt something like health coaching into the practice, goes back to the office manager saying, nope, not gonna get reimbursed, we're gonna lose money, how can you afford this, right? And in my passion and philosophy, it's never about whether it works or not, it's whether about how is this gonna help my patient and how can we incorporate it. and developing a structure to support that. And that's something that we've done over the last year and a half at Texas Center for Lifestyle Medicine. But I'll tell you, it's so great because everyone looks forward to coming to work. Every single person in my office looks forward to coming to work because we are a very, very special system, and we know how we can help the patients. And it gives us such a high level of confidence, right? And so if I'm a practitioner and I know that my patient after this short visit is going to be signed up to this health coaching group on Thursday and a one-on-one health coaching the following week as a follow-up to that group visit, I know that, okay, well, I now get to control, their schedule. I can see whether they've been to this meeting or not and try to figure out why they haven't, if they haven't been, right? And offering patients a pathway. Rather than visit to visit, you offer them a pathway of a multidisciplinary approach. And that's what people are looking for, and that's truly what healthcare should be. And I think that's what it's intended to be from a number of years ago, not to the system it is right now. In the beginning, we're like, well, should we charge cash for it because it's very, very intense? Should we charge insurance? And as I think with most, people doing primary care, there's a big question mark about these codes, because in Medicare there's preventative codes that we can bill for, and now in private insurance there's also the lifestyle modification, and then there's medical nutrition counseling (MNT) codes, right? And the whole other subset for group visits and stuff like that. And these codes are different based on their existing diagnosis, and they're different based on if they have Medicare or not. Private insurance is very different. And so the complexity of doing this is pretty substantial when we first started, because we don't know exactly, we have an idea what we get reimbursed, but we don't know how often that is, because a lot of people need a lot of hand-holding and stuff like that. And then through Medicare, you also have CCM, which is chronic care management, which is its own program that's billed based on time spent for patients per month, right? And to enroll the patient in chronic care management, we either do a verbal agreement or we could do a written agreement. And the Medicare patient is responsible for 20% of that. So, if you do a certain amount, for example, let's say if you use one code, then the Medicare patient is responsible for $6 per month of this one code, and that's all based on time. So there were a lot of things that needed to come in play for us to utilize this. And where health coaching comes in is that health coaching can come into a lot of different categories. So I think most people think of a health coach as just a health coach category, but health coach could be administrative, health coach could be clinical, health coach could be a neurocognitive support, which has its own set of CPT codes, procedure codes. Health coaches can provide as a clinical liaison between the physicians and the practitioners and the patient. And all those things are things that we can actually bill for in insurance if it fits a specific criteria. But like I said, it's pretty complicated. And so I'll give you an example. Let's say if you have two patients coming in, a husband and a wife, right? And the husband has diabetes, hypertension, dyslipidemia, metabolic syndrome, and has AFib and heart failure, okay? The wife is pre-diabetic and dyslipidemia, all right? So if you were to set this husband and wife up with health coaching, the husband qualifies for more procedure codes because there's more comorbidities. And so there is medical nutrition therapy for diabetes, for face-to-face visit and for group visit, for Medicare, and for heart disease. There's annual screenings and preventative codes for heart disease. These are what we call G codes in Medicare, and for hypertension, it's got its own G code as well. And then there's other things that exist within a Medicare wellness visit that the health coach can actually participate in. Screening for STDs is another CPT code in Medicare, and screening for other preventative care things like colon cancer screening and stuff like that. So these procedure codes, some of them directly reimbursed, and some of them are built out so that Medicare can look at us and say, hey, we're doing a really good job. And so Medicare can say, this practice is doing such a good job screening for colon cancer, doing all this stuff, and we actually get bonuses on top of that.
Wow.
At the end of the year. Right. And so it's not like it's not your typical business where you do something and you get reimbursed for it. It's a whole performance aspect of it. And because CMS, Center for Medicare and Medicaid Services, is switching to a value-based model with a Medicare shared savings programs and everything like that, we're now seeing that we can make sure that these diagnosis codes and CPT codes are built out, but we may not enjoy the fruits of that labor for another couple of years, depending on which accountable care organization or anything that you're in. So for a lot of practices that are not in accountable care organizations, you can still submit Medicare savings through generally their electronic medical record system or some sort of data set to submit. If practices are on paper, then you can do it manually as well. So there's a lot of programs that Medicare wants us to switch to a value-based system, right? Now for private insurance mirrors Medicare codes, but it's a lot simpler actually. And there are there's lifestyle modification and lifestyle codes that are there if the patient had dyslipidemia, hypertension, metabolic syndrome, one of the Z codes of BMI, any of the Z codes of BMI above 30 for obesity, and a couple other ones as well. And so these are generally I call them the 99401 to 99403 codes. These are 3 specific codes that's based on time. And this is probably the most common set of codes that we use for lifestyle management. And so it's not. I wish it was as simple as someone sitting down and say, hey, we can provide these services for you, and I can have a prediction of how much we get reimbursed, but we really can't until the patient has comorbidities. So in functional medicine, we do a lot of disease training with autoimmune, right? Autoimmune, without any of the other metabolic codes, they don't qualify for a lot of these different categories. But with autoimmune, we certainly can find comorbidities if we're detailed enough, right? And so we're doing advanced lipid panels on these patients. They actually do have dyslipidemia, and now we can have dyslipidemia counseling with the patient, but at the same time, with the functional coaching, talk about autoimmune elimination diets and detox and stuff like that. So this requires a billing and documentation system and an algorithm so that we can sort of run patients through. So a little over a year ago, I started working with a billing company to look at how to incorporate lifestyle medicine into regular clinical practice, right? And that's the company's called MPE Consulting. I'm their advisor at this point. And within all their primary care practitioners that are there, there's actually multiple integrative health practitioners that's not really taking advantage of these codes. So we're actually helping these practitioners develop an algorithm so they can start hiring health coaches. And we'll have a look at how predictability of how we get reimbursed. Right now, we're a year and a half into the process, so we have an idea of the reimbursement, but we don't have a solidified idea because of a delay in bonus structures of 1 to 2 years for Medicare shared savings. But at least it gives us a rough estimate of what we should really expect. So a health coach that gets hired into a practice should be a long-term investment for the practice, like multi-year investment for the practice, right? And I think, and I wish it's as easy as just putting someone in and then just starting and boom off the bat, but it's not. It's not. And so we use eClinicalWorks, which is our electronic medical record system. And within it, we can build templates and billing templates and structures and structures of templates and documentations and order sets so that, with a few clicks, we understand what the documentation requirements are for this visit. And then there's free text of other things that are in there. We could talk about autoimmune and rheumatoid. We could talk about, fibromyalgia and all stuff like that, right? That may be outside of what the billing structure is. That's the foundation of what we wanted to do. The other thing is we wanted to in-house health coach. We didn't need an in-house health coach in the very beginning, but our volume got so tremendous. In-house health coach was very important. So we actually, our first health coach, Jenny Moreno, she's a mind-body medicine practitioner and a functional nutritional coach. And she's a Tai Chi master and all this crazy stuff, right? So we started integrating the mind-body medicine, Tai Chi and all this stuff into the health coaching platform. But it's not like you're billing for Tai Chi, right? You're billing for the mind-body.
Right.
So the reason I mention mind-body is that there are neuropsych codes that can be billed if it's called incident to billing if there's a practitioner that's supervising the thing. So the practitioner, the provider can do a physical exam, do a quick HPI, review the systems, have that documented, and then the health coach can take over. We call that an incident to the health coach is billing incident to the physician, right? And
Can you explain what an HPI is?
oh, sorry, HPI. Yeah. HPI is a history of present illness. It's
Okay.
basically history taking,
Thank you.
right? And and the review system is going through every body system to make sure we didn't miss anything. And so, the part where the health coach really comes in handy is taking over that visit after the practitioner's done with that portion, and then revisiting with the practitioner to make sure all the plans are congruent. Because the practitioner is the one that puts in the diagnosis codes, the health coach cannot, right? And so under those diagnosis codes and under those, whether it's dyslipidemia or obesity or whatever, that's where we can play around with the structure of the billing, right? And so at the end of our health coach session, Jenny takes him over into our gym area. We have a physical therapy and gym area, and she does Tai Chi with them to end the session. It's like, in a balance, right? And it's very nice. The patients love it a lot, but it's not like we're billing for the Tai Chi and the bow. We're billing for the disease modification, right?
Yes.
And so mind-body medicine is very interesting because whenever any health coach, any functional medicine health coach is trained on, there is a significant effect on mind and body effects, right? The sympathetic, parasympathetic meditation and stuff like that. And there's a strive to really understand it in our patient population. In terms of billing side, 2019, there's new codes that replaced old codes in terms of neuropsychiatric evaluation. So there's scoring cards and all these things. Wisconsin scale, there's a GAD scale for anxiety, and all sorts of different things. There's ADHD scales. All these scales are tools used by us to figure out a scoring system of how people do. And that's how we collect data. But those scoring systems, there's actually procedure codes for those scoring systems. So that's where the health coach come in. Hey, let's get the scoring system down in full analysis. And then the health coach can participate in helping the physician submit procedure codes that deal with a neuropsych evaluation, right? That's physical exam plus psychiatric evaluation, right? And that psychiatric evaluation doesn't necessarily have to be done by a psychiatrist. It has to be done by a certified professional who understands this. And of course, you can refer to neurologists, psychiatrists, whatever you want to do to have a backup support system from a primary care practice. But what we like to do is that we do submit these neuropsych evaluation codes, and some of them are done on computer. Like patients can go on the computer, and there's actually a neuropsych evaluation code that's called automated neuropsych evaluation versus by a technician versus by a provider. And these are all different codes that we can submit. And so, and one visit can qualify for multiple different CPT codes. And so I want to talk about one example, really simple example, but really effective. So we use, the prolonged fasting mimicking diet program. It's a 5-day fasting mimicking diet program where people will just eat out of this box, right? But there's a lot of complexities that kind of go with it. And we require a lot of follow-ups to make sure that patients are compliant with it, right? And patients we're troubleshooting anything that may come, whether if they feel like you have headaches or dizziness or anything like that. We have to make sure they drink plenty of fluids, because for some reason, when most people fast, they forget to drink water, and just because they have a restrictive mindset, I was like, no, you just gotta drink your fluids, and then their headache goes away and whatnot, right? So that requires our health coaches to come in and take over and make some phone calls, right? Okay. And so in the fasting mimicking diet, it's 5 days, and we like to set them with an initial call, talk about the fasting mimicking diet, or if they're in the office and our health coach has an open slot, they can talk about it. But generally, the providers talk about it as well. And if providers talk about it, the providers also bill lifestyle modification codes on top of their E&M visit. E&M basically is our codes for the actual provider visit. And so when they get the box, this Prolon, they go home. It's very intimidating because you open this giant box and there's 5 days in there. You're like, okay, I got this. It's easy. But people aren't supposed to microwave the thing. They're not supposed to eat nuts or anything outside of it, right? And they're supposed to be very well hydrated, right? And sometimes the directions can be a little murky too. And so our health coaches are now going to be said to reach out to them, say, hey, it's day 3, how do you feel? Do you feel hungry and stuff like that? And that's where the troubleshooting comes in. Now, how are these billed? How are telephone calls billed? If they have Medicare, that could be part of their chronic care management program, and that could be time spent on clinical time spent, that can be billed out at the end of the month, right? If they don't have Medicare, if they have private insurance, there's actually new codes for 2019 that deal with virtual consults for medical nutrition therapy, okay? And those are billed in conglomerate times as well. There's also new codes that deal with medical disease management. And so where if a provider calls and a health coach calls and then my medical assistant calls, and we're all trying to work together on this patient for the fasting mimicking diet or anything that's similar, those are all time that can be built at the end of the day for the patient. Now that's new, that's brand new, okay? As far as I know, we're the only practice that use it, so hopefully it stays around and we can get data on it. But these are the things that are so important to know because we want to get paid. We want to provide service. We want to be reimbursed for what we actually provide, but I want to still work within the system. And I don't think it's fair to just say I'm gonna give up on the system and charge everyone $200 for a health coach for this month or something like that, right? I don't think that's for me, and that's the reason I started Texas Center for Lifestyle Medicine, is I want to be involved in the Medicare population and everything like that too, because a lot of people who are in that situation already have a hard time, and they have and financially it's not the best, right? But with Medicare actually pays for most of health coaching, and everyone is surprised when I say that statement. You can have health coaching systems where Medicare truly reimburses for most of this, which is very exciting, and the private insurance actually even more so. So now we come to a time where we have some billing structures set up, but then the next question is, well, I'm a health coach, and how do I convince my doctor of this? It's hard. It's really hard to convince your doctors that insurance is going to pay for this stuff, because traditionally that's not how doctors have been billing. Doctors have been billing these E&M codes, which is basically the physician visit codes and everything like that, right? But I do consult for MPE Consulting, and MPE is actually able to consult in that instance if anyone's interested. With this structure, we can see and place different microstructures within a practice, and that's what I aim to do by 2020. It's 2019 right now. By 2020, I want to be able to get this structure in place. But that's why we're having this interview. But this structure is multidisciplinary. It requires office manager to be on board. It requires a medical assistant to be on board. It requires medical assistants to be able to bill. Okay. It requires health coaches to be on board. Health coaches to be able to bill. It is a very, very conglomerate structure that really has to talk to each other. So.
Well, I think this will transform the world of health coaching, because many people think that it's not possible, that you cannot get reimbursement through private insurance or Medicare. So we're here today to say that it is. We're not saying that coaches or anyone who wants to be a coach has to become a medical biller and has to memorize all those codes and be very proficient. This is a full-time, complicated job. It requires a lot of training. People who are working in medical practices as billers, that's their dedicated role. But the health coach can bring to a practice the promise that these services that are so crucial to the health and well-being of patients can be reimbursed. And I love your mission to really serve people who can only afford these services if it's reimbursable through insurance. So it's a very effective way to serve the underserved. And many people who come to the Functional Medicine Coaching Academy want to give back, they want to serve, they want to work with people regardless of their ability to pay. And this is an opportunity to do that. So I want to thank you for this wonderful, informative presentation.
No, thank you.
Thank you, Dr. Ruan.
Thanks, appreciate it. All right, bye guys.
Bye now.